Always weigh your baby with the same amount of clothes on. If this is a naked weight, that's the way it needs to be done. And if they, you know, I've seen great variances in weight, and it's because the doctor's office weighs them with diapers on, etc. Temperature monitoring, right there, of the newborn. That temperature probe goes up to the Ohio bed and plugs in, and you set the temperature that you want to keep your baby at. And you do not trust that that baby is that temperature. You go back and temp your baby often to make sure that they're not burning up. Remember, this is a piece of equipment, and equipments can malfunction. Procedure for vitamin K. Allow the skin to dry. That's the worst thing you can do. I hate when people go to give me a shot and they put the alcohol in and they want to shoot the needle in right away. That's why it stings, because you don't let your alcohol dry. So let your alcohol dry. And what's the vitamin K shot for? And there's your injection site, your vastus lateralis. It's the only site that children get needles in. And here's your ophthalmic ointment. We tack the lower eyelid and you put it in. And you don't use this again. It goes in the trash. This is single use. Why do we put antibiotic ointment in the baby's eyes? The umbilical cord base is carefully cleansed. I don't see any of the purple Jensen violet like they used to use on it either. And boy, if that stuff gets out of hand, I've seen kids with streaks of purple all over their belly because somebody put too much on. Circumcision using the Yellen or Gomco clamp. I always used a Gomco clamp. And when we would set our babies up for circumcision, then the residents would come in and do them. And you got to make sure that that foreskin is even all the way around that clamp, because I've seen bad circs, and it was the most horrible thing you ever seen, that the baby's penis was cut all the way to the shank, all the way down to the scrotum, because somebody did not pull the foreskin evenly around the Gomco clamp before putting the Gomco clamp on and using that the knife. Make sure that is even all the way around. And that's the Gomco clamp. That must be a Yellen, because I've never seen stitches. And this is another thing called a Plastabell. And they put it on, then they cut around it, and then they put a little piece of gauze on it. And I don't do it for the next few diaper changes. I do it until it's healed, because that sticky serous drainage sticks to the diaper, and then when you pull the diaper off, you're pulling that. It's like pulling a scab off. The baby starts to cry again because it sticks to the diaper. So I use it for a couple of days, and I teach the moms how to pull the foreskin back to make sure that it doesn't crawl back up there and try to attach itself again. That's unnecessary. And this letter to your baby, it's very, very cute, so please read it. Father demonstrates competence and confidence in diapering his new baby. Steps in wrapping a baby. Irritable, fussy babies, a lot of times they feel like they're lost out here. And if you bundle them up and make them feel real snugly, then they can they'll sleep for you. They'll sleep a lot better when you bundle them. That's just showing you how to wrap your baby. Infant car restraint from birth to 12 months. We make our parents bring them into the hospital, the car seat. Bring it in so that we can see that you have it, because you can't leave the hospital and put the baby in the car without a car seat. It's the law. Teaching checklist is prepared at the time of discharge to make sure that we've gotten our return demonstrations, that we've done everything that we're supposed to do before we let this little baby go home. Signs of newborn transition. Tells you about the pulse, what happens to the pulse, the blood pressure, and all their vital signs after they're born. Signs of neonatal distress. Always, 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 when you see substernal retractions, if you see that skin going in between the ribs, that baby's struggling for breath. Nasal flaring, another struggling for breath. Grunting is another thing that babies that are struggling do. Excessive mucus, facial grimacing, cyanosis, abdominal distension, vomiting bile-stained material, terrible. Absence of meconium elimination within 24 hours of birth. Absence of urine elimination within 24 hours of birth. Jaundice of the skin within 24 hours of birth or because of hemolytic process. Temperature instability, hypothermia or hyperthermia, and jitteriness or glucose less than 40 milligram. These are babies that are not going home right now. When parent needs to know about newborn care, you teach them about the uncircumcised penis, you teach them about technique for waking the baby and dressing the baby and voiding and stooling and what to look for. And I tell parents very simply, if it's sweater weather for you, it's sweater weather for your baby. Don't dress your baby like an Eskimo when it's warm, and don't let them be uncovered when it's cool. I always tell them to keep their head covered for the first year because they lose a lot of their body heat. That's the biggest uncovered surface on the body, and that's where they lose all their heat from. So I keep a hat on them, not to take them out into the sun. That's why you have those shields and things in your windows in the car. And also to that babies wear one layer more clothes than we do, so that onesie serves as that one layer, and then they dress like we do. If we have to have a sweater on, the baby needs a sweater. Cover their face when you're outside and the wind is blowing so that debris and things doesn't blow on the baby and the baby doesn't lose its breath. When your baby doesn't always falls asleep, you got to undress them a little bit. That makes them a little bit cool and uncomfortable, and that'll wake them up for their feedings, because you don't want babies to sleep through feedings. And I tell brand new moms, don't let your baby can sleep through one feeding, do not let your baby sleep through that second feeding. Any baby can sleep through one feeding, but don't let them sleep through a second feeding. Cord care. I do not use a Q-tip. I take a cotton ball in alcohol and I squeeze it out good, and I get down inside the ridges. The whole idea of cord care is to dry up that umbilical stump and let it fall off. Now in some countries they save it, it's their customs or whatever they do, that's up to them. But to clean that cord, I do it every diaper change. I don't fool around and say, oh, I only do it 2 or 3 times a day. Every diaper change. If it does not fall off within 14 days, there's a possibility for infection, and the doctor may have to go in now and cauterize it and make it come off. It needs to fall off. So that's why you want to dry it up with alcohol. And the baby's going to cry. It's not because you're hurting them. It's not because you're doing any damage to them. It's because they don't like that cold alcohol. But get in there and clean it out good, and it'll keep it from being infected. And here's when they should call their healthcare provider. Your baby is getting sick when they don't eat. When babies and little children get sick, they don't eat well. And that's the first sign that something's going wrong. Temperature, vomiting, and it takes very little for a brand new infant baby to be dehydrated, 10% of their body weight. So if they throw up once and they have diarrhea once, this could lead them on their way, and they're not eating, they're on their way to dehydration. Insensible water loss is not only from breathing, but also that temperature. You can't measure the water loss, but temperatures take away fluids. So that's another way to know that your baby's on its way to be dehydrated. High-pitched cries. Green, watery, or black stools. And always explain to your parents the difference between diarrhea and a loose stool. Do you know the difference between diarrhea and a loose stool? We'll discuss that in class. Danny, these 4 chapters go with day 5 of reproductive health. I will give you the rest of the chapters for day 5 and day 7, which I recorded before, so that you can put them together, and I'll give you the tests and all that. But these 4 chapters go with day 5, and the other 5 chapters go with day 7. Thank you very much.